Okay, so we're here today with Irma. Hi, Irma.
Hi.
So Irma is concerned about her cheeks and the texture of her skin. Is that right?
That is correct.
Did you have Botox before, fillers?
I did.
How long ago?
Probably like 6 months ago.
Okay, so she's had injectables 6 months ago. What we're going to try to do today is we're going to try to change the texture of her skin, rebalance her, and rejuvenate her. What I'm going to do is inject into her skin a combination of Botox and Juvederm. And I call it the Myint Tox Therapy. And what we're going to do is diffuse this medication under her skin, just under her skin. We're not going into the muscle, we're not going any deeper than that. We're just going to try to change the texture of her skin. And the way I'm going to do that is I'm going to deliver the medication through this portal, and this is a micro-channeling technology that was patented. It's fantastic. I think this is the future in the way drugs will be delivered into the skin for skincare. So there's gold-plated needles that each needle is thinner than a human hair. And what we're going to do is, as I go in, the medication is going to diffuse just under the skin through these needles. And the reason why I do it this way instead of using, let's say, a syringe with the needle, which is how we always do it, is because there's less pain, no bruising, no black and blue, and very quick. Okay, are you ready? So I've already wiped her off with alcohol. And we're going to get started here. And here we go. So this is the first one. How does it feel?
Not bad.
Feel anything?
I feel it, but it's not bad.
And basically what's happening is you can see tiny bits of fluid on the surface of the skin, but the product, and I can see this, is being delivered right under the skin, and I'm overlapping a little bit. And as I do this, what we're going to try to do is help her with her pores, is what Botox is going to do. And it's going to turn a little bit red. I'm going to help her plumping her skin up a little bit, which is what the Juvederm does. How's it feeling?
Not bad at all.
And you can see it's turning slightly red. That's kind of what I want. And is there any pain?
No.
No?
No.
Okay, good. We're going to turn over here. So we're going to do a little bit on this side now. And then we're going to see her back usually in about 2 weeks to see how she's doing. And if she gets the response that I expect her to get, you're going to see her back in about a month to a month and a half, and we're going to redo this. And I tell patients that you probably need to maintain this every 1 to 2 months to keep it going. And it's somewhat of a micro needling technology, but the technology here is not only achieving micro needling, but you're actually delivering the medication right under the skin. Is it okay?
Yeah.
So these tiny needles, they're so tiny, it's not going too deep, and that's why she doesn't feel that much of pain here. So you can see on the layer that wetness. That wetness is the indication that this is all penetrating under her skin. And that's kind of what you want to see. And we can do this all over the face. You can do it in the chin. Sometimes the Peau d'Orange here can make a sort of a stipple-looking chin. So we're going to try to smooth that out by injecting in this area as well. And again, I'm going right under the skin, just barely under the skin to help with the pores. Not going into the muscle, not going too deep, like the traditional injections that we do to relax muscles so that you don't have movement. This is a very different method here that we're trying to do, and a method we're trying to accomplish. You feeling okay?
Yeah.
And that's pretty much it. So she didn't feel any pain. right?
No,
There's
pain
no
at all.
bruising. There's a little redness from the actual micro needling, and she can go to dinner. She can go out. She can do whatever she wants. Wear makeup, and there's nothing else that she needs to do. She'll come back in 30 days, and we'll look at it again. So that's the Myint Tox Therapy that goes subdermal into the skin with this aqua gold technology that I have.